Health insurance is crucial and one of the 6 building blocks to ensure universal health coverage. Each year, 100 million people are impoverished as a result of health spending, and Nigeria loses $1 billion annually to medical tourism. The National Health Act was enacted in 2014. This in turn contributes to the more than 10% of the global maternal deaths from Nigeria.
The general public is yet to fully grasp the fact that health is a human right. So politicians are not getting the backlash they deserve for the absolute negligent neglect of the health service.
NHIS, as an implementing and regulatory organization, has also suffered from ineffective leadership, lack of succession planning, and a poor governance structure over the years.
If you look at the deliverable of how many states have their own scheme up and running, it is 0. Many states are a little bit along the way, but that's the most difficult part. Getting up and running is the hard part, and that is really what NHIS needs to migrate its role to.
Nevertheless, some states have begun to develop their own health insurance schemes.
All the widows in Delta, we group them, and we have about 5,550 widows are receiving care under the scheme, and they are not paying. Some groups are paying for them. And the question is, how will you sustain it? Yes, someone who received 7,000 and he got good health care over the year, it's likelihood that majority of them will return to want to sustain it by themselves.
Extreme shortages of health workers exist in 57 countries. 36 of these are in Africa. This is responsible for poor health care on the continent.
One of the things I want is for the health sector to have its own NYSC scheme, or rather NYSC should hands off anybody who is a graduate of health allied professions. So they should just pass them over, and would set up a health, set up the organization that would then deploy these as village health workers.
To provide quality and affordable health care, there has to be a synergy with technology.
There are many health apps that can free patients from even too frequent consultation. You have information apps, you have the ones that connect you to doctors where you can have online consultations, you have the ones that connect doctors in urban centers through telemedicine to rural areas where by simple telephone technology they can have instructions, guidance on how to treat simple cases.
With health insurance being a very major key factor in the universal health coverage, Nigeria is not doing very well at it. We have only 5% of the population covered by insurance. It is very important that health insurance is provided for the entire population to ensure that quality health care at affordable prices are provided for every Nigerian, as health care is a right and not a privilege. Susan Jasper, reporting for Plus TV Africa.